My name is Joyce Hollander Rodriguez. I'm a family physician in Klamath Falls, Oregon. I work at OHSU. So many factors go into sort of the distribution of where healthcare providers end up. Some of that comes with just who's coming into our medical schools. Are we recruiting people that come from rural areas originally? And we see that that's a very small percentage of the people that end up going to medical school. We also see so many changes that happen while you're in medical school and residency. So you are most often moving to an urban area to be in medical school. You move to urban areas to frequently be in college, and then for medical school as well. And then so much of your root setting years, these are the things as young professionals where you often find partners, buy houses, start families, develop your adult life and sense of self. If all of those things happen in urban areas, then we don't go back to rural areas. So if we make more opportunities where people who come from rural or under-resourced communities can actually have those activities happen in those communities, they put their roots down, they develop their adult friendships, their partners, their families, their connections, their sense of community. It either stays in a rural community and they maintain the connections they've had their whole life, or they do that adult work in that community. And so if your professional self and professional community is developed in a rural area, if your mentors are all there, then that's what you do throughout your career. So we need to reverse the trend that we've had where everybody goes and stays in urban areas. We need to get people actually doing that in rural areas. One of the things that I hear over and over from the people in our community is they want to know if you are going to stay. It is so important to them. When I tell them, oh, I've been in Klamath Falls for 19 years, they think, so you're actually staying. And when a new provider comes into our community, they want to know if they're going to stay. If they hear that they bought a house, they're excited. They want to see signs of connection with the community. And that's so important because a lot of people who live in rural areas, they have seen turnover in their healthcare providers. They've seen their healthcare providers retire or move out of the area. And so they've experienced that over time, and they've experienced the shortage of not having great access to primary care, to the specialists that they want to see, traveling long distances to get those services. And so if they hear about providers that are going to be there and are anchored in the community, that is so meaningful to them because they want that connection. They want to know that they're getting healthcare from somebody who shares that feeling of community.